Welcome, welcome, welcome. We are so excited to have you here with us today. We are going to be talking a little bit in the next hour with you about warm handoffs and how we're able to successfully use that as a way to help our mobile crisis services to pair the people that we're serving with the resources that they need. So we are excited to be here with you today. These are trainings that are sponsored by the California Department of Healthcare Services, and M-TAC, the Medi-Cal Mobile Crisis Training and Technical Assistance Center, is the one who's helping to put these trainings together. So we're very grateful for all the hard work that they've put into these opportunities for you today. We do also want to share that this training is regards to mobile crisis services. And as you know, they're designed to provide rapid response, individual assessment, and community-based stabilization to Medi-Cal members who are experiencing behavioral health crisis. The real focus is to provide relief to members in a behavioral health crisis using de-escalation techniques and stabilization techniques. We want to really reduce immediate risk of danger and harm and avoid unnecessary emergency department care, psychiatric inpatient hospitalizations, and law enforcement involvement. So what we really focus on with mobile crisis is that the change in mobile crisis services is really so that the response is more resolution focused. So we're meeting people where they're at, helping them to decide with voice and choice what they want their next steps to be, and then working with our community partners to provide relief. It's really supporting people with the least restrictive means necessary, and you'll hear throughout the training honoring that they're trauma-informed, culturally responsive care that's being provided in a very person-centered way. And these are some of the real important tenets of the trainings that you'll have heard throughout if you've attended them before, is that these services are designed to be person-centered, trauma-informed, equity-driven. So we want to make sure that all of the people, all of our members have access to the most highest quality, excellent mobile crisis care. Brief interventions are what we'll use in our trainings that are evidence-based, that help to de-escalate and are more resolution-focused, working from a lens of least restrictive interventions, and that are culturally responsive, linguistically appropriate, and accessible. All right, I'll just introduce myself, and I'm going to turn it over to my colleague, Avery. I'm Jennifer Hodgson. I'm a principal consultant at Health Management Associates. My background is in behavioral health. I taught for 24 years in higher education. I'm a licensed marriage and family therapist, and I'm extremely passionate about equity in healthcare and making sure that everybody has a chance to live their best life and to be as healthy as possible. So I'm really excited about being here with you today, and I'll turn it over to Avery.
Thank you, Jennifer. Hello, all. My name is Avery Belyeu. My pronouns are she and her. I'm also a principal consultant at Health Management Associates. And I've been working in the field of public health with a specific focus in suicide prevention for about 15 years. And like Jennifer, I'm very passionate about health equity and a person-centered approach to care. So I'm really excited to have this conversation with you today. And I want to say thank you to everyone who has introduced yourselves in the chat. It's really wonderful to see all of you here today and who are sharing a little bit about what you're hoping to learn today. So like Jennifer said, if you haven't done that already, feel free to add that content. We'll be looking at that as we go. We hope that this will be an interactive conversation as much as possible. We've built in moments for you to interact. So we'll be looking at that chat. I have it up here on my screen, and we would love to have this be a conversation together. So here is where we're headed today. This is our agenda for our time together. We're going to talk about our learning objectives, what we're hoping for all of us to take away from this training. We're going to do an introduction to warm handoffs. What are they? Why are warm handoffs effective? What do we know from the research about why they're effective? Then we're going to talk about different warm handoff strategies. Exactly what is a warm handoff and what are strategies and approaches to doing them effectively? We're going to talk about the key components. What are things you should always think about when you're doing a warm handoff? We're going to touch a little bit on transportation and a few other considerations that are listed specifically in the bin as it relates to warm handoffs. And then we're going to talk about infrastructure, things that we would suggest you start thinking about now, ways to collaborate with your community partners in order to effectively facilitate warm handoffs. Then we'll summarize all of those good learnings together, and we'll have time for us to have some dialogue back and forth with Q&A. So that's where we're headed. And here is what we're hoping to learn. So here are our learning objectives for today. We're going to review the requirements for warm handoffs as they're related in the bin. We're going to explain the key components of a warm handoff. What are those core components you want to have when facilitating a warm handoff? We're going to talk about the value of them. Why are they an effective means for increasing safety and improving outcomes per the research? We're going to talk about a person-centered approach. You heard Jennifer mention earlier that that's one of the central tenets and goals of mobile crisis, is to take a person-centered approach. And warm handoffs are a really great example of where that comes out to play. So we'll be talking about what a person-centered approach to warm handoffs looks like. And then, as I said, we will be taking some time to talk about infrastructure needs. So we'll talk about what are some things you should be thinking about as it relates to collaboration so you can effectively coordinate to do warm handoffs well. And then we'll talk about some of those other considerations like transportation that you'll need to think about as you think about how to implement warm handoffs successfully. So we do want to acknowledge that if you've been coming to these trainings for a while, there's a variety of curricula you've been exposed to. And a lot of these conversations, especially the further we go in these trainings, are building on each other. And so there's a lot of content we're going to be talking about today that connects to content that you've heard in the past. So previous trainings that relate to this topic include the crisis safety plan development and the community partnership coordination strategies. And you'll actually hear us bring in some of that content today, so you're seeing how all of these things connect. There also are some upcoming trainings that are also related to today's content information, and that includes transportation strategies for members experiencing a behavioral health crisis, which will occur on October 25th, and documentation requirements for mobile crisis services, which will be delivered on November 16th. So we'll reference some of these upcoming trainings, remind you to register for those as well, so you can continue this connection of the content that you learned today and continue those building blocks. If you want to access any of the trainings that this is connected to or other trainings, you can do so on the M-TAC website. And we'll make sure to put that link for you in the chat so you can see exactly where you can access that content. So we're going to start now by talking about what is a warm handoff. So some history and background on the term warm handoff. It originated actually in the customer service world, interestingly, where it was used to describe a referral that ensured a customer was connected to someone who could provide the thing that they actually needed. So this term has been adopted by the healthcare world and the behavioral healthcare world to talk about connections between one member of a healthcare team and another member of a healthcare team, with a focus on making sure that that connection is made in a way that that the team members assure that they can talk about why this person is the best person to handle this concern with the individual, explain that person's competency, and emphasizing that to the person receiving care. Oftentimes, warm handoff is used to describe a handoff between a medical provider and a behavioral health specialist, which in some ways relates to our content today. And in this strategy, the emphasis really is on engaging the individual in crisis and the family in this warm handoff. So they're coming alongside you to make some of these decisions with you. And you're going to see that's the theme of how we talk about warm handoffs today, that it's really a conversation about how you engage with an individual and their support network to help you make decisions together about their next best steps. So that's a little history and background of the term. Now, what does the bin say? So the bin, we're going to reference the bin multiple times today because it explicitly says some things about warm handoffs, and we want to make sure that we're all on the same page about exactly what the bin says and what that means for the purpose of our conversation. So the bin has a couple things to say. One is a description of what a warm handoff is, that it includes coordination with other delivery systems to facilitate care transitions and guide referrals for members, ensuring that the referral loop is closed and that the new provider accepts the care of the member. And it states that such decisions should be a patient-centered and shared decision-making process. So this is a little bit of our roadmap for our conversation today. So the few things that I would really highlight here and call out that all of us should pay attention to is that this is about continuity of care with these care transitions. It's about making sure that referral loop is closed and that the providers have had communication with each other. And it's about doing this in a way that's person-centered and has a shared decision-making process. So what else does the BIN say? Sorry, my slides are skipping ahead there. It's a bit of a lag. So the BIN also talks about the fact that there may be a need to transport the person to a higher level of care. And we'll talk about transportation. We'll unpack transportation explicitly later in the training. But there's a few things from this component of the BIN that I explicitly want to call out so we make sure we're all on the same page when we say warm handoff in the context of mobile crisis. What exactly do we mean? So first of all, it should be noted that the mobile team is charged with arranging for and providing transportation. And again, we'll talk about that a little bit later in the presentation. The BIN also uses the term alternative treatment settings. So what does that term mean? For the purpose of this conversation, that refers explicitly to higher levels of care. So you see a description here of what some of those may be. It could be a sobering center, crisis respite, a crisis stabilization unit, a psychiatric health facility, a psychiatric inpatient hospital, a general acute care hospital, or a crisis residential treatment program. Those are just some examples of what we mean when we say an alternative treatment setting. We should note, of course, when we're doing safety planning that there may be coordination with other types of facilities that aren't being listed here. But for the purpose of this presentation, when we're talking about a warm handoff, we're explicitly talking about a warm handoff that happens between the mobile crisis team and these type of facilities explicitly listed here. So just to make sure we're all kind of narrowly on the same page around what today's conversation is about. Okay, so a summary, we've just talked about a lot around warm handoffs to set us up for a successful conversation. So first of all, a warm handoff is a handoff that's conducted in person. It's between the mobile crisis team and another provider. It happens in front of the individual in crisis and the family or other support network if present. It includes the individual in crisis as a team member, so they can hear what's being discussed about the problem, they understand their own status, and they're participating in co-creating their plan of care. This is how it's person-centered. It's person-centered, it actively engages the individual in the decision-making process, and we'll be unpacking that and highlighting that as we go along. Warm handoffs require really good collaboration and coordination with both providers and facilities. And that's why we're going to have an infrastructure conversation later, because you need to make sure that you have the infrastructure in place to have this really effective collaboration and coordination between your mobile crisis teams and all of the different providers and all of the different facilities that are listed in the examples we gave earlier. And we did note that warm handoffs may require coordination of transportation as well. And again, we'll be talking more about that. So that's a recap of what a warm handoff is, its key characteristics, and also the key things that we want to note from the requirements in the BIN for all of us to be mindful of as we have this conversation together. So why is a warm handoff effective? So what makes them effective from the research? What do we know? Well, the first thing, as I've been saying multiple times, is that it's person-centered. So we know that this has exponential benefits for an individual in a crisis. It engages them and their support network. And we do know from the research that that engagement, that collaboration improves outcomes and it improves follow-through. It improves commitment from the individual to follow through on a care plan, a safety plan. And it also assures that their entire support network is understanding what the next steps look like and how they can participate in supporting their family member or their community member. It also assures that individuals are matched with the best possible resource for their needs. And we're going to talk about this when we unpack how you do safety planning in the context of a warm handoff. But a key part of an effective warm handoff is a conversation with the individual about the needs that they have, and specifically if there are any special needs they have, culturally or linguistically. And a warm handoff assures that you're being sensitive to make sure that, if possible, the facility or the provider that you're making that warm handoff to is a good match for that individual, and that the facility understands any special needs they may have that may impact their care being effective or not effective. We'll talk about this a few different times. One example I would offer of this is for LGBTQ communities. Many times LGBTQ individuals in our community will know better than ourselves whether or not a particular facility or provider has a reputation for being culturally fluent regarding LGBTQ issues. And so bringing someone alongside you to help them make that decision with you about the best place for them to go for their next step assures that they're actually going to get the best quality care and the care that they need. A warm handoff really also helps create a feeling of empowerment. So rather than decisions being made for someone, the mobile crisis team is coming alongside someone to say, let's make these decisions together about your next best steps. And let's make those decisions in front of you. So you're not being talked about behind your back, but rather you're coming alongside and we're having all these conversations transparently. It engages someone in their own care and their own next steps, which helps someone to feel a sense of empowerment, which from other trainings, no doubt, that you've participated in, this is an important point because someone in crisis may feel that they don't have much control or power in that moment. So this is the beginning of building those building blocks of feeling that sense of empowerment for their own care and their own next steps. We've said this a few times, but it also creates clear communication about what those next steps are. So part of the goal of this is to assure that any ambiguity around next steps is taken away, that it's really clear what the next steps are. And we're going to talk about how a warm handoff is actually making sure that connection happens between the mobile crisis team and the next facility or the next provider. So there's no doubt about who the next person is that's responsible for taking care of this individual, for collaborating with them in their care. And we also know from the research that doing that, making that step to assure that continuity of care also increases someone's treatment compliance and the support of their entire community. The last thing we would note, which is really important, is that having this transparent approach to making this handoff, make sure that the individual and their family can verify that information that's being shared between providers is correct. So that's going to impact the quality of care, right? To make sure that all of the information you're sharing, that you've heard from the individual about the crisis itself, about the needs that they have, that information is correct. And it allows the individual or family or support network to offer additional context or corrections where necessary, which again really does have an impact on the quality of care. So another way that warm handoffs are effective and why they're important is that the research shows that it improves safety and outcomes. So we've said this a few times in the last slide, but the research really does demonstrate that having that reliable and effective communication between providers is really important for improved clinical outcomes. So this really contributes to that continuity of care that we know is so key for making sure that someone actually gets the care that they need and that care is offered effectively without the frustration of trying to figure out what their next step is and whether or not their new provider really understands what their needs are. It also facilitates that clear communication between providers, and it decreases the risk of communication breakdowns. All of us, as we've navigated healthcare systems ourselves, no doubt, and perhaps behavioral healthcare, have had situations where the ball got dropped, where we didn't know what the next step was for ourselves, or where communication challenges and breakdowns caused problems for ourselves. So doing a warm handoff and doing it effectively makes sure that you are caring for that individual as you connect them directly to their next provider. And it decreases the risk of the frustration of those communication breakdowns, which can sometimes be a really substantive barrier for someone who is just trying to get effective care for their next steps. The other thing that the research shows is that effectively doing a warm handoff really helps us meet some of our broader goals of mobile crisis, that warm handoffs are a really great strategy for reducing urgency department visits. And of course, we noted in some of the settings, sometimes there would be perhaps an emergency department would be the place where you're doing a warm handoff to in some context. But of course, one of our goals is to directly connect someone to other types of treatment facilities rather than emergency departments, which are oftentimes not best equipped to handle their next steps. And so the research shows that doing this warm handoff, right, having a conversation around understanding what their needs are and deciding what facility would be the next place to connect them to could reduce ED visits. It also can reduce law enforcement involvement in crisis management, which is also, of course, one of the goals of our mobile crisis teams. And of course, again, the highlight is connecting a member directly to the most appropriate follow-up resource. And that's going to improve outcomes because they're going to be matched to the resource that really does match their needs. So I presented to you some of the benefits of warm handoffs in the context of mobile crisis. So we'd love to hear from you for a moment about other benefits that you might name in addition to the ones that I've named and the ones that the research is currently demonstrating. What are some other benefits that you would maybe note as it relates to warm handoffs? If there are others that you would name, we would love to see those as well in the chat. And while we're doing that and looking for those responses, go ahead on to the next slide and we'll reflect back on some of your responses here in a moment about identifying a warm handoff strategy. And Jennifer, I'll turn that over to you.
Absolutely, absolutely. Well, I know that many of us couldn't do the work we do without being able to connect to other people. And maybe it's from our own personal experiences where we've had somebody just approach us at a very vulnerable time and in a way that allowed us to lean into that help and support. And that's really what this is all about, is just coming up with strategies for connecting with people when they are in their most vulnerable state. People with a lot of pride, people with a lot of reservation, people who've had experiences where kindness wasn't always the intention. So I think just being very culturally responsive, being very trauma informed, really walking with that person through this process is where we're going to be leaning into with these strategies. So, but we welcome at any time others that you've known work for you as well. So when we look at warm handoffs within the context of mobile crisis assessment, these can occur at many different time points through the process. It can occur at dispatch, and it can occur during a mobile crisis visit. It may even possibly occur when you're doing your follow-up call, and they mentioned there's a need there as well. So the capacity to walk with somebody, through an observable need to connecting them to a resource. For different people, it may be different things, but we want to make sure that we're able to do this in a way that really honors where their next step is that they need. Now, some of them might be more urgent, emergent. Like when we look at something like a physical injury, clearly that's going to require a really quick, warm handoff and transfer to a service that's going to be able to care for that person, whether it's something that requires an urgent physical need or something that requires something be addressed, but maybe doesn't have to be that moment, that day. Maybe your, person that you're working with doesn't have a primary care provider, or maybe they have been struggling with healing issues. And so we need to get them to somebody who that's where their specialty is, particularly for people who have diabetes. Healing from injuries can take an extraordinarily long time, and they run the risk of infection, which further complicates lots of things. So being able to sort of walk with somebody through, okay, you have this physical need. Let's get you connected with the right service at the right point in time. And I'm going to stay with you until that connection is made, either on the phone, the appointment is scheduled, or that person has arrived and they are helping you. Some other situations that might require a warm handoff could be unsafe conditions. If there's a lethal weapon that's present on the scene, maybe there's an environmental concern. We may have, lots of people, maybe there's a riot, maybe there's a smell of gas. When you go into a building and you're trying to support somebody who's in crisis, but you can smell something that indicates it may be an unsafe environment. It could be weather, natural disasters, and, people are, needing support and care all times of the day. And so that may also be where we might need extra help to ensure that the conditions are going to be safe for that person to be seen at that location. And maybe we need a warm transfer to 988 until we can get there safely. So warm handoffs can occur between different services. in order to really make sure we're getting the best care and the safest care possible. And I know that's all very, very important to you, not only for the people in crisis, but for our teams as well. It could be that there's note of a dangerous or a protective animal. So animals generally, when they are, see different unfamiliar people coming into their environment, they may get very defensive because they're protecting their owners, and they know their owners are vulnerable. They know their owners are having a very difficult time. And so knowing that before you go out to a call, and it might be that we need somebody to come and help us handle the animal so that we can get to the person in need. So potentially there may be resources that we can use within our community where we can call people in who are very skilled at that so that we can then help the person in crisis. And also an abusive person, if there's somebody there who's with that person in crisis who may not be safe around that individual or the mobile crisis team, that may be another instance where we need to have a warm handoff and have law enforcement come and help to make sure the environment is stable so that we can provide the care that we need. Sometimes warm transfers happen with a lack of, actually, this is really a very, very big one, is a lack of access to basic needs. So you're going and working with somebody in a park who is in need of crisis services, but they're also in need of shelter and of food. They're also feeling unsafe, because they are maybe hiding from somebody, or they're afraid to go back to where they were because that's the reason why they're in such a difficult situation right now, and they need help because that environment isn't safe. So in order for us to be able to help the behavioral health pieces, making sure that we can do warm transfers to get them connected to these safe places so that they can heal and they can begin to get through this really difficult time with the right resources in place. And then again, connecting them, as Avery mentioned earlier, to follow up resources, substance use treatment centers, behavioral health treatment services, maybe the regional center if it's somebody with an intellectual developmental disability. And there's so many wonderful resources that they can use when they may not be familiar with it, or they've heard about it but haven't know when to call or how to call. That can be a resource that we can provide as well to get that ball rolling. So what other conditions, please feel free to put in the chat, what other conditions where a warm handoff might be beneficial to a person in crisis? Can you think of other resources or times where this would also be helpful? And I think we have a few comments already coming through, Avery. I don't know if you've been fielding them.
I have. So I just wanted to highlight, so some folks in response to our last question about warm handoffs offered a few examples. And I wanted to call out Leanne's example, which I think is a really great example of exactly what we're talking about. Leanne says that they do a warm handoff from their K Street clinic, which is a very structured program, into an outpatient program, which is more peer-led. And that as part of that, they do a tour with the staff and meet the new case manager before they start. So that's a really great example of implementing some of the best practices that we're talking about, a little different than from a mobile crisis team to a facility, but it has some of those core components, right? That you're facilitating that conversation between providers, you're making sure they're comfortable, you're making sure they understand who the next person is they're going to be working with and why they're qualified to provide that help. So thank you for that example, Leanne. I think it demonstrates some of the core components we're discussing.
I think you're right. And I think Letitia also had commented something similar too, and that this the bi-directional nature of this, whether we're doing those warm transfers with people who are going to have continuity care with behavioral health facilities or providers in the community, helping them to work through accessibility barriers, whether they need predominant language or they have difficulty, transportation, or whether they might need or benefit from a telehealth, all of those factors, how can we help them? And then when they're exiting, as Leanna said, a locked facility, that reintegration, back in trying to figure out how do we then acclimate them back into their community where they feel they have the opportunity to continue to heal and get the support and services they need. Kevin also said from law enforcement or ER staff to other providers as well. Absolutely. Absolutely. Okay, we'll continue putting in the chat other conditions or opportunities where you've found or noticed warm handoffs can be very, very helpful. Because oftentimes we'll provide people with a list of referral resources and phone numbers. But for somebody who's experiencing a crisis, that can be overwhelming. Even making a phone call can be overwhelming. Making an appointment can be overwhelming. Just being able to verbalize what's happening in their life to somebody else can be very difficult. So that's where we come in, is sort of helping that process along with them so that they can then get that connection. We can take that first step. When I did therapy for years, I used to share with my clients that I think half of the healing process is just those first steps of making the call, making the appointment, and initiating the service. So once you've done that, you're halfway there in some respects, because that's where we're leaning into trust and we're leaning into asking for help, which are oftentimes things we're socialized not to do. And now we're trying to amend that. So you're vital, vital people to that process. Okay. So making the determination. So if the person in crisis needs urgent medical attention for that physical injury we were talking about at the previous slide, we should engage 911 immediately and then continue to gather information. So if we determine that 911 is needed, instead of continuing to assess on other variables, we're going to go ahead and make that call, get the services engaged so they can be on their way, and then continue to get information that we'll be able to communicate to who's ever dispatched to where we're at. We can communicate that information once they arrive or on the phone with them as they're en route. So, but we want to get that call in right away, and that's part of that warm transfer process. If the person is experiencing an opioid overdose, our mobile crisis team should immediately have naloxone administered and contact 911 right away, because you have that window of time where it's effective. So we want to have 911 en route so that they can get there and continue providing that medical care to that individual. Inclusion of EMTs, advanced EMTs, paramedics, community paramedics, those are all county level resources. So it'll be really important to figure out what are the community partners that you'll have, and as you're building your implementation plans, or you've already built them and expanding them, is to look around and to see, what are the different services and resources we have so we can provide the right size support. And then in the bin, we do know that it has languaging around that EMTs, AMETs, paramedics, and community paramedics oftentimes have the best positioning to support those physical exams when they're needed, and then provide that individualized care to our members who are at risk of preventable hospital admissions or readmissions due to chronic care or acute physical needs. So if we can provide services at the point of need instead of having to always transport people to the hospital, that's one of the intentions of the bin, is to really making that option available for people. And our communities and our counties are the ones who can help us do that. Some questions to consider when you're developing that implementation plan then. So as you're getting your stakeholders together and you're really building these important plans, under what circumstances would you engage in a warm handoff with 988 Suicide Crisis Lifeline? So it could be that those dispatch lines are separate, and in some of our counties, it might be that they're together. So we're seeing lots of different combinations of partnerships that are happening across the state. But when you do want to engage with them, knowing that 911 lifeline person may not be in the same county, they may not be in the same area, they may not be in the same state. So we want to really understand with that plan so that our mobile crisis dispatchers and teams know what those partnerships look like, under what circumstances would they engage. And likewise, like if they call mobile crisis and they decide they do not want an in-person visit, but they would welcome somebody to talk with them on the phone, is that an opportunity for us then to do a warm transfer to 988? So these are the circumstances in which you want to really have these conversations to figure out how you're going to work together in partnership. The same thing goes with your local law enforcement. Different counties have different resources available to them. Some counties can do what's called a joint response. So if there are concerns about safety, that you can dispatch both the mobile crisis team and law enforcement will be dispatched as well by their own dispatch service, and they'll meet together at the location, determine safety, and then the mobile crisis team will take over that care. So working together can be different county to county based on the kind of resources that you have available to you. We want to make sure that we're minimizing use of law enforcement and using them only when we really, really need to. But it's nice to be able to have that opportunity where you can then either send them out sequentially, like they go and then they'll call mobile crisis and say it's good to go, or it was not safe, and we had to transport the person. So those partnerships need to really be solidified. 911 dispatch as well is another one, to be able to let them know, listen, we're developing our mobile crisis service. This is what we do, so that they're aware that they can also, warm transfer people to the mobile crisis dispatch line as well, so that we can get them care. And likewise, when we go out and if we're working with people in the field and we see that somebody needs, and we need to make a call to 911. So what are those circumstances? FERS is our Family Urgent Response Systems. We're going to learn more about that at an upcoming training, but these are for our children who are actively involved or have been involved in foster care and their caregivers. It's a fantastic resource for Californians where they can also provide mobile crisis support. But many of our members may not either know about FERS or have accessed them. So that can be part of our warm transfer, is helping them to, showing them the website, showing them the various ways they can access services, and then even putting them in contact with somebody through FERS that can talk through that process with them. Do you have any other community partners or dispatch lines that you want to put in the chat that you've also found helpful? There are warm lines. There's an adolescent warm line that oftentimes people will also recommend, but you may know of others, and we welcome you to put those in the chat. Another determining factor of this is if the person is in crisis, communicates intent to harm themselves or somebody else, and they have the method and the access to identified lethal means, then law enforcement and 911 should be engaged as part of that response plan. Again, if the county has joint dispatch as an option for them, that may be one of the things that they opt to do, and that will be in part of their implementation plan. Mobile crisis dispatch may send a mobile crisis team or warm transfer again to a crisis line, as we said on the previous slide, when appropriate. Usually that's when the caller declines mobile crisis services, but they still need help and support. So that's why it's important to know when you're going to go back and forth and work together with the 988 crisis and a suicide crisis lifeline in the event that that happens. So some key components to a successful warm handoff is, again, be in person whenever possible. So we want, hopefully, more of our visits are going to be where we go to the site, help the person where they're at, and work with them and their family or support systems present to help de-escalate and resolve the crisis as much as we can at that point in time. And at least then understanding what the plan can be from there and warm transferring if needed. We want to include an introduction by the mobile crisis team member to the next care provider when able. It's really nice to be, because what happens if I'm the provider, I'm borrowing rapport that you've established. So that means that I'm going to probably have a more successful transition of care to my service with this member because they trust you. They trust that team member. So that introduction is really valuable. We want to make sure our mobile crisis team are definitely providing all the important details that that service is going to need to step in and provide the best care with that person. We're going to include a review of next steps. So we want to make sure our members and their support system know, here's what I'm going to do next. This is what you can expect. And then who's responsible for each? Because when we're in crisis, it's hard to remember all those details. So sometimes we may need to write it out. Sometimes they might want to put it in their calendar. I mean, whatever is going to work for that person. We want to review those steps. We want to make sure we're also tuning into what's most important to them. Sometimes when we get in our space of wanting to be helpful, we might lead with what we think is helpful instead of what they need. So we definitely want, before we make that warm transfer, make sure that that's the thing that they really are welcoming as the next step. And we want to provide an opportunity for all participants, including the person in crisis and the family, to ask clarifying questions, confirm information, making sure before we leave or we discontinue our care at that point in time that everybody is understanding what the plan is, who's doing what pieces, and all questions have been answered. I'm going to turn this over to Avery for more considerations.
Thank you, Jennifer. So I mentioned earlier that transportation is explicitly listed in the BIN as part of warm handoffs and what's engaged in a successful warm handoff. So this is the component of the BIN quoted here that specifically relates to transportation. It does say that when needed, a mobile crisis team shall arrange for or provide transportation to an appropriate level of care or treatment setting. So we think about what our goals and purposes are of a warm handoff. This is helping answer that question, how am I going to get there, right? And as Jennifer said, one of the key components, what we're hoping for is that this, as much as possible, is happening in person. So it's creating a really tight loop of that continuity of care and removing as many barriers as possible. That's a lot of what we're talking about here, is removing barriers for the individual in crisis. And transportation could be one of those barriers. So the BIN does explicitly state that one of the roles of mobile crisis is to arrange transportation. So what I will say, the key kind of takeaway from this is that transportation is a part of this conversation, and also that there's going to be another training about transportation. So be on the lookout for that training, transportation strategies for members experiencing a behavioral health crisis, which will talk more about transportation as it's written throughout the BIN and how mobile crisis teams are expected to arrange for transportation, as well as the reasons why that's so important. So a few times in this conversation, we talked about infrastructure that you might want to start to build now as you think about your implementation plans. So what we're going to do in this section is go back and draw on some of those building blocks, some of the conversations we've had in previous trainings, and also think about some of the things we've described today, how there might be tools that you want to develop that will help facilitate these warm handoffs being effective. So the first thing that I would highlight is the system collaboration model. So in a prior training regarding community collaboration and coordination, we oriented you to this model, which is a 4-phase model that's constantly in conversation with each other. Each of these 4 phases that you would need to engage in to successfully engage your community and your partners for successful crisis intervention in your community. And so the thing I would highlight from that presentation is that we spent a lot of time on that first phase, which is relationship building and crisis system mapping. And that's where you build relationships with all of these different facilities that we've talked about today that you might actually do a warm handoff to in person, that you build that collaboration so they know who you are as the mobile crisis teams, you understand who they are, you understand the services they offer, and you also understand who point people should be in those facilities for you as a mobile crisis team. In the second phase of this system collaboration model, the collaboration that should be happening between the mobile crisis services, the mobile crisis teams, and these facilities is helping co-create strategies around how you work together. So an example of those strategies for the purpose of warm handoffs, and we talked about this a little bit in this training, this is where the rubber meets the road, is co-creating protocols. So when you're doing a warm handoff between the mobile crisis team and this facility, what is the protocol for what that looks like? Who is the main point of contact at that facility? Is there a number that you call beforehand? What is their process? What do their internal procedures look like for warm handoffs to effectively occur? And so doing this work, this preparatory work, is really a crucial part of you being successfully set up for particularly in-person warm handoffs, because you're coming to that agreement together around shared protocols of how you'll collaborate to effectively implement warm handoffs. So then in that third phase of this collaboration model, you're orienting all of your workforce to these shared protocols so that there's no ambiguity around, if we're taking someone to this particular facility, this is our shared protocol with them for how that warm handoff will be most successfully implemented given their internal protocols and procedures. So this is something to think about as you think about your infrastructure needs. What of these components do you need to think about as you're building those collaborations, you're building shared protocols? Warm handoff should definitely be a part of those protocols. So something to think about here, this is a lot of what we've just said on that image, is that you want to have these shared protocols to facilitate those warm handoffs, and that could include information such as the key contact leads at the facilities, any agreements that you're going to have regarding how those warm handoffs occur, any process between the mobile crisis team and the designated facility representative. Again, part of our goal in this, in addition to being person-centered and assuring that the individual has you helping them in every step of this process, is also to assure really effective communication so that that continuity of care is very tight, that communication is clear, and that no one drops a ball. So having these shared agreements will assure that you're successfully able to do that. And then we think about the community partnership piece, and we talked about the community collaborations that you'll want to effectively implement mobile crisis. We talked about a variety of different types of community partnerships, including advocates. So when you're having those collaborative meetings, conversations around things like cultural fluency and cultural competency will come to play. And so those community partnerships are really key to make sure you're understanding what are the most appropriate resources in your communities, and maybe where are those community partners helping each other to assure that they really truly are being facilities that are going to be able to provide the best possible care for all the different groups who may belong to your community. Something else to think about, and perhaps your mind was already going here as you were thinking about this warm handoff process, particularly as Jennifer summarized the various components, the key components of a warm handoff, is tools that you might want to develop for warm handoff. So at the end of the presentation, we're going to show you a slide that has a bunch of resources. You'll have access to this later, including the links. Most of the tools that have been developed up to this point for specifically warm handoffs oftentimes are for warm handoffs within a closed system, perhaps in a large hospital system between one type of provider and another. So there are some examples on some of the websites that you can link to. And from my review of that, here's some things that I think might be helpful, in addition to having tools which would perhaps be like your protocols that you have developed between facilities, is a tool that you might want to develop to help inform the individual and their family about their next steps. So as Jennifer said, you might want to write some of this down. If you co-create a tool and have a tool ready to go where you can put some of that information, including the key contact information for the next facility that they're going to, or the next individual they're being handed off to, any particular next steps and timelines, and then also any statement of the needs and desires that they have stated. Having all of that on one piece of paper that they can have, that the facility can have, that you're facilitating a warm handoff to, will be a really effective tool to have all of that in one place. As Jennifer noted, oftentimes if you're in crisis, it can be really overwhelming when you're trying to figure out some of these next steps. You might forget or not entirely hear some of what's being said. So having a tool like a one-pager where all of this is being written down, both assures that you're effectively communicating to the next facility, the next provider, but also that the individual has access to all of that. So this is part of you having that person-centered approach, and a tool like a one-pager might be a great place to start. So we'd love to hear from you about what you feel like your next steps are to create and build the infrastructure and tools to effectively facilitate warm handoffs. We've shared a lot of content with you today about what warm handoffs are, considerations about how to do them well, about why they're effective, and some ideas around the key components. So when we think about some of this infrastructure needs, what do you feel like are your next steps as you're building out your plans around how you're going to implement mobile crisis? If you want to use the chat, would love for you to place in the chat anything that you're thinking about your next steps to maybe build some of this infrastructure. It could be protocols. It could be a tool like the one that I just listed. Would love to see what those tools look like.
And Avery, we've had some great chat I thought maybe you were going there too.
Yeah, go ahead, Jennifer.
Yeah, just Jennifer said a couple of great ideas. One is, really building a partnership with your local Alzheimer's Association. They are fantastic. And oftentimes, they can maybe even do some trainings for your mobile crisis teams to help them understand when you're going and working with somebody who's in crisis who may have a dementia, or we suspect could be. And there could be lots of things happening while somebody might be struggling. There are definite ways of interacting that help de-escalate that are different than some of the de-escalation strategies we may use with people who are not experiencing dementia. So the Alzheimer's Association is a great community partner. And then they can also warm transfer to groups that they might have. So being able to engage caregivers in additional support services, members in additional support services. So I think that's a great lead, Jennifer. And then another one, she said, Jennifer's on fire today, is just having regular meetings and tours of facilities in the network. This is one thing that I thought was really helpful when I would train beginning therapists, and I would take them on tours. Some of the biases that they had about what happens when people go to those different resources and services and facilities would really start to go away, because they realized they were fed by things that maybe the movies portrayed or past experiences, and things had changed. So I think it is really important that you take those tours and really look at those facilities so that your teams can truly speak to what it looks like when you walk in the door. There's a beautiful waiting room, or there's somebody that will greet you and in your preferred language. And then they're going to explain, this. And as you step through it, the humanization pieces of that are really helpful. And there's an increased chance that person will actually follow through. So great ideas, Jennifer.
I love that. It also, I would want to highlight some of the other suggestions too. Jacob talked about doing monthly or bi-monthly meetings with partners. And so thank you so much, Jacob, for saying that. Our earlier slide where we talked about the community collaboration model, and that training, one of the things that we proposed is that you're building a coalition, so that you, as a leading mobile crisis, you're building a coalition that has leadership representation from all of these facilities that you might be collaborating with, and you're meeting on a semi-regular basis to talk about your protocols, to talk about how the implementation of those protocols, how it's going, whether or not there are any barriers to success. So I love that suggestion, Jacob, to have these regular meetings. And if you think about all of the different types of community organizations and services you might need to connect with effectively because of being mobile crisis, there's this kind of coalition that you can build. Perhaps other coalitions that already exist, you can build on, it sounds like, in some instances, to be a convener of all those folks in one place and have those conversations together. So no doubt there's a lot of generative work that will happen if you use that model to have those type of coalitions. So thank you for highlighting that.
Absolutely. Great. So we'll just kind of go through this summary, if that's okay with you, Avery.
That sounds right. Take it away.
All right. So we want to just impart a few final thoughts as we, send you on your way today. And thank you again for sharing this time with us. We know you have lots of options and things that you can do, but today this was great to share this with you. So warm handoffs really do ensure continuity of care. We know through research that increases the likelihood that people will actually utilize that service and support. So having that referral loop closed is really important. And you're a big part of that process. You're an agent of helping connect them using your rapport to the next service. We know that warm handoffs improve outcomes. So not only does it improve the likelihood they'll use the service, it improves the outcomes that they themselves will benefit from it, and increasing safety by increasing communication between providers. So we right-size the expectations and the service to that individual. We know that a person-centered approach is critical, and not only does it help us to be trauma-informed and culturally responsive, but it really helps us to make sense we're building the right steps to get them to where they want to go, understanding their needs, their preferences, experiences they may have had with different community resources, so that we can help them to find the ones that are going to best meet their needs. These warm handoffs should always occur in front of the individual to ensure transparency, clear communication. They hear what you're saying, about them, so that helps them to be able to see this as something that's for them and not done to them. Infrastructure is really, really important. So having those stakeholder conversations, touring those facilities, developing those memorandums of understanding, having your implementation plans be inclusive of all the wonderful resources that your county may have available, either virtually or in person. All of this is really important to having a very successful mobile crisis service. All right, and please continue to put questions in the Q&A if you have them, or in the chat. We are welcoming any. If you think of things afterwards, you can always email as well, and we will address that and get responses to you as quickly as possible. We know that sometimes it takes a few minutes for things to soak in, and then you're like, oh, I wish I would have asked that. So please feel free to respond with questions anytime today or in the future. And we have those office hours that are also planned. Those are wonderful opportunities for you to also bring those questions to a live group of people who can then help, discuss it and work through some of those questions you might have. So keep your eye out for those office hours as well. So we do thank you and hope that you found all of this helpful. There's contact information at the end of the slide for people that you can reach out to for general questions or more specific questions, as well as references for all the information that was provided today. So again, thank you very much. We appreciate spending time with you.
And Jennifer, I just want to highlight, there was one question around whether or not warm handoffs are always to a higher level of care. And we had some participants jump in and help answer. So I'll just quickly say, as we're closing, that as we said at the beginning, those alternative treatment settings in the bin were narrowly described as being to a higher level of care. And that was kind of our context for today. But thank you for participants jumping in and talking about this construct we're using around warm handoffs. Could happen to a variety of different types of facilities, including a place that they'd already been in the past. So thanks for folks for asking the question, and then other participants jumping in and helping to answer.